Inuarata no Sahai is still my amiable name, and I'm so happy, delighted, always excited to come your way every Wednesday since the last 16 and a half years to add premium value to your day. You know, our series has been on different leadership styles and their impact on workplace dynamics. A simple definition of leadership is that leadership is positively influencing people towards achieving visions and towards achieving set goals. And for you to be effective in doing this as a leader, you should understand that you should be able to apply different leadership style as scenario changes, as situation changes. And that is why we are actually focusing on this topic, you know, different leadership styles and their impact on workplace dynamics. And you know, the template, the model we are using is to use a case scenario, you know, to look at it, you know, so that you can practically glean the insight and be able to apply it in what you do as a team head, as a leader, as the head of a department or the branch of an organization, or you are the one pioneering and running your own vision. Different leadership styles and their impact on workplace dynamics. Now, the leadership case scenario we are going to look at today, the template we are going to look at today, the case study is going to show us how a leader applied the coercive leadership style and then later transited into the coaching leadership style. And that is, you know, a characteristic or a trait that every leader must possess to be able to know that having applied a particular leadership style, when there is a need for you to switch, especially when situation changes, you should not hesitate. Shift quickly, and that is very important. And the case scenario that we are looking at today is shifting from coercive leadership style to coaching leadership style in a dental department of a state specialist hospital. That is what we are going to look at today. Remember, the coercive leadership style is that leadership style that is a command style of leadership, the one that says, do as I say, do what I tell you. And that is always very helpful when we are managing crises, when we are handling emergencies, and also when we are treating issues of serious indiscipline. Very helpful. But when you overuse the coercive leadership style, people, you know, are going to become kind of get tired as a result of you being overbearing. You are going to also see a situation where, you know, people feel micromanaged, and at the end of the day, you know, you may just lose good hands. It also, when overused, it also stifles creativity and innovation. So, but you should know that this is the right situation to apply it, and then when there is a need for you to transit or shift, make sure you don't hesitate. And the coaching leadership style is a leadership style that focuses on developing people for the future, ensuring that the capacity of your team members are built for them to be able to always handle responsibility, you know, handle issues as the organization move from point A through B to C. So the case scenario that we are looking at this morning is the shifting from coercive to coaching leadership style in the dental department of a state specialist hospital. So let me just go into the case scenario and then we look at it together. The phase one of the case scenario, the crisis and the coercive response. The dental department of a prominent state government specialist hospital began experiencing severe spike in post-extraction infections, threatening patient safety and the hospital's reputation. An internal audit revealed that junior dental officers and clinical assistants were cutting corners, frequently skipping standard autoclave validation logs and rushing the chemical sterilization protocols for dental instruments between patients to reduce wait times. It appears, you know, they actually wanted to help to reduce the waiting time of patients, but, you know, some things were compromised. Safety protocols were ignored. Recognizing an immediate crisis of patient safety and professional indiscipline, the newly appointed head of department stepped in with a strict coercive leadership style. There was no room for debate or consensus building. The HOD issued a direct mandate. 1, effective immediately. No clinical procedure will commence without a signed and verified sterilization log for that specific instrument tray. Then secondly, Any officer or assistant found bypassing this protocol will be instantly locked out of the clinical duties and referred to the hospital's disciplinary committee for gross misconduct. The HOD strictly monitored compliance, conducting unannounced spot checks twice a day. While this rigid top-down command created temporary tension and anxiety among the staff, it achieved immediate results. And that is the use of the coercive leadership style, to see that crises are immediately, arrested, and then we are able to return back to doing things the way they should be. Infection rates dropped to 0 within 3 weeks, and absolute compliance with safety protocols was restored. The coercive style functioned perfectly as corrective life-saving tool. I'll take that again. The coercive style functioned perfectly as a corrective life-saving tool. Then the phase 2 of this case scenario. Remember, the case scenario is focused on how the head of department of a dental department in a state specialist hospital was able to transit from a coercive leadership style then to coaching leadership style. Then we are now on the phase 2. He has applied the coercive. Let's see how he was, when he saw the need to shift to the coaching style. 2 months later, the crisis was entirely resolved. The safety protocols had become second nature to the team, and the atmosphere had shifted from chaotic to stable. However, the HOD noticed a lingering side effect. The team had become overly dependent on instructions. Junior dental officers were hesitant to make minor clinical decisions, constantly seeking approval for routine procedures out of fear of making an error. Realizing that keeping the coercive brake pedal down would destroy initiative and stifle professional growth, the HOD deliberately pivoted to the coaching leadership style. Instead of dictating terms, the HOD began scheduling weekly clinical review sessions. During these sessions, when a junior resident presented a complex case, the HOD no longer gave flat directives. No, he has now, he has saw that, okay, the system order has restored, and there is a need this time around to shift leadership style. Continuing with the coercive leadership style will not help matters on the long run. So there is a need to apply the brake pedal on that and shift ground. Now he's employing the coaching leadership style. Instead, the HOD asks guiding questions. Looking at this panoramic radiograph, what are the 3 possible approaches you see here? What are the long-term risks of that specific treatment plan for this patient? They have moved into the coaching style. The HOD paired senior dental surgeons with junior officers for mentorship, coaching, allowed room for supervised autonomy during minor surgeries, and transformed errors into learning opportunities rather than disciplinary offenses. As soon as order restored, to the dental department of that specialist hospital, there was now the need to change leadership style. Now, over the next few months, the department evolved from a fearful compliance unit to a highly capable, self-assured team of professionals ready for future leadership roles. So what's the leadership lesson as I begin to conclude this morning? What are 2 leadership lessons we can glean from this in order to make sure that we know how to practically know the time to transit, to shift from a particular leadership style like coercive leadership style, which is a command style of leadership, do as I say, to a coaching leadership style, which has to do with building competency and developing people or team members for the future. 2 practical lessons. Number 1 lesson: situational fluency protects organizational culture. If the HOD had relied solely on the coercive style, the department would have eventually suffered from severe burnout, low morale, and a toxic culture of fear. Conversely, if the HOD had tried to coach the staff through the initial infection crisis, the delays caused by the discussions and feedback loops could have led to catastrophic patient outcomes. So he knew that at that time that there was crisis, coaching wasn't needed. It was coercive, but he didn't remain on that coercive. He was able to also transit and shift. The lesson here: leaders must view leadership styles not as identities like I'm a coaching leader, or I'm a democratic leader, or I'm a coercive leader. You shouldn't view leadership style as identity, but as tools in a toolkit. The situation must dictate the tool. Very important. Coercive style fixes the now. Coaching style builds the tomorrow. Then the second lesson: leadership must match the maturity and competence of the team. Leadership must match the maturity and competence of the team. Or another way of saying that is that leadership style must match the maturity and competence of the team. The appropriate leadership style changes as the team's capability changes. In the first phase, the staff exhibited a lack of discipline and a low maturity level regarding critical safety standards, which required forceful commanding presence. In the second phase, once the team became competent and compliant, their needs shifted from supervision to empowerment. From supervision to empowerment. That means from coercive to coaching. The lesson: if a leader fails to transition away from a command style once a team becomes competent, they may stop leading and start micromanaging. And micromanaging is very dangerous for a team, where people no longer have the liberty, the freedom to make even simple decisions to advance the team forward. When you keep using the command and control style, which is a coercive style, you know, the system may just nosedive, and things may not go the way as intended when it comes to expected outcome, you know, for the organization or for the team. So remember that, you know, there is no one size fits all leadership style for all situations or for different situations. A leadership style that works in a particular situation may not work when the situation changes. So you as a leader, be smart. Be very, very smart, be intelligent to know that, okay, having applied the pace-setting leadership style in this situation, it's time to move into the coercive leadership style, or transit into the democratic style, or move into the coaching style. So this is what we are going to be doing on this series as we make progress into the future. I'm going to be coming up with different practical case scenarios on how to apply this leadership style transition. You know, we are looking at different leadership styles and their impact on workplace dynamics. So we'll be looking at how a leader applied, for example, a pace-setting leadership style. You know, pace-setting has to do with setting standards and then exemplifying the standard as a leader. And then maybe later you now move into democratic leadership style, or move into, you know, coercive leadership style, or you know, other leadership styles as the need arises. I believe that profound value have been added to your day. I know you want to connect with me, so you can send your questions, send your inquiries to my email right there on the screen, inuagata@gmail.com, INUAGHATA, inuagata@gmail.com. Send your inquiries, send your questions, and then give you feedback, and then we're able to take things to the next level for you, especially as a team leader. I'll be seeing you next week, Wednesday. And when I return, my name will not change. It will still be the amiable Inuagata. No, Sahai. Your day is so blessed. Thank you.